Incidence of people who are young having strokes is going up in America.
From Dr. Oz.
He's my age. It's kind of scary.
To people on the street.
I think we all need to be a little more health cautious. You never know what's going to happen.
We're all talking about the stroke that killed actor Luke Perry. Today on Fox 11 News in Depth, we'll look at the causes of stroke, the symptoms to watch out for, and what to do if it happens to you or someone you love. Fox 11 News in Depth starts right now. Hello, everyone. I'm Hal Eisner. The news of Luke Perry's death was shocking. He was fairly young, back on TV, and then suddenly a stroke. It's the young part that has people wondering, how could that happen? Maybe you thought it happened only to the elderly, but strokes can hit just about anyone. He was known to millions. First as the rebellious bad boy on Fox's Beverly Hills 90210.
I just don't believe in winning through intimidation. Unless, of course, I'm doing the intimidating.
Then to a whole new generation as the dad on the CW's Riverdale, and now tragedy at age 52, a stroke that sent him to the hospital and then took his life.
It may have been that he just had an aneurysm, an outpouching of one of the vessels that burst, that broke, leading to a massive stroke.
In the weeks ahead, we may learn more about the stroke that killed Perry, but his death has sparked a conversation because he affected so many people.
It's devastating. I mean, you know, as a youngster growing up, 90210 was kind of like a fixture in the household.
Other celebrities have brought attention to strokes over the years. The death of actor Bill Paxton, the loss of speech that TV host Dick Clark suffered.
People are looking to the future with hope.
Clark later died not of a stroke, but of a heart attack during surgery. Dr. Oz has a show here on Fox 11 every weekday filled with important medical advice. He tells us being young is no defense against having a stroke.
There's a stroke in this country once every 40 seconds. So because there's this high incidence of stroke, there's plenty to go around, and young people are not immune to it, especially in African Americans, young men in particular with high blood pressure.
Other risk factors: smoking or vaping nicotine, drinking too much alcohol, and being obese. But even without any of those factors, it's important for everyone to know the symptoms of a stroke.
If you're sitting with someone at work and they all of a sudden develop slurred speech, they can't walk, they have numbness on the side of their face, or a severe headache, that can be the sign of an acute stroke.
They say there's nothing more important than our health. And we're hoping the advice you get here today could possibly save a life. Joining me now is neurosurgeon Dr. Param Yashar. Did I say that right?
Absolutely.
Thank you. And he's from Dignity Health Northridge Hospital Medical Center. We also have neuroradiologist Dr. Suzie Bash with RadNet Radiology. And I kind of want to start with you because I'd like to know what your reaction was when you heard about Luke Perry.
Well, it was very shocking. I mean, he was universally loved by everyone, and it's just very unexpected. And so it was a real tragedy. It's also an eye-opener about stroke. It's triggered this big dialogue throughout the country, which is a dialogue that I think we really need to have. And so it's sort of as a testimony of how well he was loved, the fact that people are talking about this.
And I think, you know, the point that sort of comes home to me every time this sort of thing happens is that we don't talk about the one that dies every 40 seconds from a stroke. We talk about the celebrity when it happens. And maybe that's a good thing because it gives us a chance to have a public dialogue and discuss these sort of things.
Absolutely. I mean, stroke occurs once every 40 seconds, a death once every 4 minutes. So if you look at the data, especially according to organizations like the American Heart Association, you have almost 1 million strokes a year, about 800,000 every year.
That's a lot.
That's a tremendous.
And thanks for clarifying it. So it's a death every 4 minutes, but it's
Absolutely.
a stroke every 40 seconds.
Exactly.
And not all strokes are deadly, right?
That's correct. But, you know, it's the 5th leading cause of death in the United States and the 2nd leading cause of death worldwide. So it's a very big issue.
There's also all kinds of new treatments for this. There's new things that break clots. Talk about that.
Sure. So the clot-busting drug that's FDA approved is called TPA, tissue plasminogen activator, and it's very good at helping to break up the clot. It's not for everyone. There are different kinds of strokes. We should maybe just talk real quickly about what a stroke is. It's brain cell death due to lack of blood flow, and there are two types. You can have an ischemic stroke, which means low blood flow where you have a blockage that's causing it, or you can have a hemorrhagic infarct, which is due to a brain bleed, due to leakage or rupture of the vessel. So TPA would not be for people that have a hemorrhagic stroke, but hopefully for people that have an ischemic stroke. And that can break up the blood, break up the clot. And then another thing we can do is clot retrieval. Dr. Yashar actually does clot retrieval in his practice, where you can open up a sort of a stent, capture that clot, and pull it out of the body.
Pull it out and get rid of the trouble. I want to go over some of the symptoms of stroke using this method known as BFAST. It's endorsed by Dr. Oz, and basically what you got there is a BEFAST representing a particular thing. So B is for balance. Have you lost your balance? E is for your eyes. Are you having sudden vision problems? F is for face. So when you smile, is it drooping on one side? A is for arms, and can you raise both of them? S is for speech. Is it slurred? T is for time. Call 911 immediately. Getting to the hospital quickly is really critical in these situations, right?
Exactly. Our mantra is time is brain. So the sooner you can seek medical attention, the faster you can diagnose that there's a potential problem, the sooner we can initiate that appropriate therapy.
Well, one of the things that's really interesting about all of this is, and let's talk about Luke Perry, 52 years old. And a lot of people tend to think, well, it's the elderly that have, brain hemorrhages or other kinds of strokes. But that's not really true.
Absolutely not. Although a majority of patients who experience a stroke are over the age of 65. A significant number of them are less than that age.
Well, how young can they be?
1/3. They can be actually babies or even fetuses. But 1 out of every 3 strokes occurs in people under the age of 65, which is not something you typically think about, because age is a risk factor for stroke.
So a 52-year-old like Luke Perry right there that we're looking at, that isn't as abnormal as one might think?
Absolutely not. I mean, we treat patients in our hospital ranging from teenage years all the way up until their 40s or 50s.
And so let's take this from step one. Somebody, God forbid, has this feeling of the smile drooping, or the eyes are out of focus, or one of these things that we just talked about with BFAST. They got to be fast and get to the hospital. And then what do you do?
Okay, so first of all, for every 1 minute where you lost blood flow, 1.9 million brain cells die, which is why we talk about, time is brain, because it literally is. So you call 911, you get transported to a stroke center. There's primary stroke centers and comprehensive. Comprehensive stroke centers have a neurosurgeon or a neurointerventionist on staff at all times. Dr. Yashar happens to be both. And you get transported there, you immediately get imaging of your brain, either with CT or MRI, but typically CT. And then from there, you make the decision point, because you have to make sure it's not a bleed. So you make a decision point of whether you can give TPA. And then if you can, they often then move on for clot retrieval.
Heart disease is the #1 cause of death.
That's number
right?
one.
Where does stroke fit in?
It's number 5 cause of death. Yes.
At least in the U.S. And as Dr. Bash mentioned, worldwide, number 2.
Wow, that's incredible. Thank you both very much. I think I've just learned a whole lot in just a few minutes. I want to thank you for being here. Still ahead.